free. She was very annoyed because the law said she gets free Obamacare. All patients will be forced to wait longer for appointments. One study noted that if every patient utilized all of the free care mandated by the new law, that the nation's physicians wouldn't have time to see a single other patient. And they make noise about overutilization of care. Physician shortages aside, 16 to 18 million of those newly insured people will be dumped into Medicaid, which is virtually insolvent in almost every state in the country, which about a third of providers can't afford to accept, and whose patients receive notoriously inconsistent care. Unfortunately, these patients will quickly discover that coverage is not the same thing as care. And what about the thousands who will lose their health care coverage when their employers decide it's cheaper to pay the fine? Or the Medicare Advantage seniors who will be forced back into traditional Medicare? Or the people who might have benefited from drugs and medical innovations that will never be discovered because of new excise taxes that will cut into the research and development budgets of medical device companies and pharmaceutical companies? Those who support the law would have you believe that they're preserving Medicare as we know it, and that, of course, the other side wants to destroy Medicare as we know it. But the law cuts $500 billion from Medicare to fund insurance subsidies for non-senior citizens. It will strain an already insolvent program, causing more doctors to stop accepting Medicare patients. Improved safety and quality? No, afraid not that either. Fewer highly trained providers swamped with more patients, more regulations, more government intrusion into how they practice medicine, more and more people with far less training providing care which used to be provided by physicians is not a recipe for better safety and quality. Plus, the cookbook medicine, which will be overseen by some of the 158 new agencies created to tell doctors what processes and procedures they approve, eliminates the all-important judgment good physicians employ to treat their patients as individuals, not as a group. No two patients are alike, but payment schemes designed to reduce healthcare expenditures don't take that into consideration. They base their recommendations on cost-effectiveness and best practices, and base what they will and won't pay on some kind of patient collective, rather than treating patients as individuals with unique physiologies and diseases. Do you guys feel like part of a collective? More efficiency? Afraid not that either. From government, have you checked the price of a stamp lately? Do you remember the $600 Pentagon toilet seats? If there's anything government entities are not, it's efficient. It's easy to spend somebody else's money foolishly. Ask the people who used to run the government accounting office. Speaking of efficiency, those 158 new agencies I mentioned earlier and the Internal Revenue Service will be deciding important things like which treatments are worthy of payment, which Americans are worthy of subsidies, which doctors are engaged in meaningful use of electronic records which aren't all that private, which accountable care organizations deserve payment bonuses, and eventually, even though they deny it vehemently, they will decide who will and will not be treated as medical resources dwindle under the burden of more and more patients who demand their free Obamacare, not to mention millions of baby boomers reaching Medicare age. Doctors will be tied to computers to make sure they're meeting government standards for treatment so they can get paid. They'll be buried under mountains of new regulations for everything they do and subject to disproportionate penalties for unintentional mistakes. They'll get paid less and less for more and more work, forcing them to spend less time with all of you. Private practitioners, if they survive the extinction level event known as Obamacare, will be forced into accountable care organizations in order to get paid at all, lumping them together with every other provider and hospital and effectively destroying physician autonomy. The Patient Protection and Affordable Care Act is also a subtle first step toward a single-payer system that they couldn't pass legislatively, although they'll vehemently deny that too. Possibly even more important than all of this, though, is that the Patient Protection and Affordable Care Act will extend an unprecedented level of government control over Americans' lives and health care choices. There are those, in fact, who believe that that's what the law was all about. Some of us might even be in this very room. Please think back to that number that I asked you to remember earlier. Remember the number? Very good. After all of what Obamacare will do to America's health, following an almost $7 trillion expenditure in direct and indirect costs, that includes the cost of unfunded mandates to individuals, businesses, and states. Nobody talks about those numbers. After all of that, by the administration's own estimate, can anyone guess how many Americans will still be uninsured?
23 million.
Exactly. 23 million is exactly the number the administration estimates will be without health care coverage once Obamacare is fully implemented in 2019. Am I the only person who thinks that's insane? The Patient Protection and Affordable Care Act is the antithesis of its name. It will not do any of the things its name implies, and it will cost American taxpayers and patients trillions of dollars to destroy the best health care system in the world. It is quite simply a big, big lie. That lie is the reason the Lehigh Valley Coalition for Healthcare Reform exists. It's our mission to educate the public about how the law will affect their health and what we all need to do to repeal it. To help people understand, we've created a short, easy-to-read flyer entitled simply, "What You Need to Know About the New Healthcare Law." It took 6 months for our committee to summarize Obamacare from the 2,700 pages that one of our nurse members read every page of, and dozens of other resources. We've placed one on each of your seats, and there are more in the back at our table. There's also a page that directs you to another outstanding resource, a series of YouTube videos created by a Colorado radiologist. Dr. Jill Vecchio is head of the Colorado chapter of Docs for Patient Care, a physician group which is represented here tonight by our next speaker. These videos will tell you just about everything you need to know about Obamacare. They're 7 to 10 minutes each, and they're worth every second of your time. We'd like to invite our Berks Patriots friends to join the Lehigh Valley Coalition for Healthcare Reform at one of our bi-monthly educational events at the Bethlehem Public Library. On June 6th, 2 doctors and 2 nurses will talk about how Obamacare will affect how you get health care. One of those nurses is congressional candidate from the 17th Congressional District, Lorene Cummings. Other meetings will be held in August, October, and December. The coalition's on Meetup and Facebook, and a link is provided in your flyer, along with links to other organizations that provide excellent resources about Obamacare. There are additional materials at our table and copies of the repeal pledge, which will be delivered to members of Congress. You can purchase our bumper stickers, which sell for $3, and our Pennsylvania-made line of patriotic jewelry to help fund our efforts. The Lehigh Valley Coalition for Healthcare Reform would like to thank Charlie Gilbert and Dr. Phyllis Parcella for inviting us to participate in this forum. Next up, speaking with us tonight about high healthcare costs and the even higher cost of Obamacare is Dr. Nicholas Pandalidis. Dr. Pandalidis is a board-certified orthopedic spine surgeon and founding partner of